Carly, why are you hiding the curtain?
I'm just made it out of the closet.
Carly. Oh, the closet you hurt yourself in.
Literally.
Oh. What's up, guys? Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor. Today we're here with Tanisha, and Tanisha, what was it, a month?
Yeah, a month
Close,
or so ago.
maybe more?
Maybe a month and a half ago.
She was organizing some stuff in the closet. She was using a step stool. Were you using a step stool?
I was using a step stool.
And she took a step backwards without realizing that she was on an elevated surface, and she caught herself on her right foot.
Yeah, absolutely.
So she rolled it, and she's getting a lot of tenderness within her ATFL and her CFL, so her anterior talofibular ligament and her calcaneofibular ligament. So right through here, you can kind of look, it's a little puffy. And today, she's having some soreness, especially with palpation around this area. But we're gonna needle her, get her feeling a little bit better, follow it up with laser.
Yes.
Yes, yes, get her feeling great. First time with needles in the foot, right?
Yes.
Cool. We'll take it slow.
Ooh. Wow.
Let's we'll just reference the video of Warren getting his ankle needled a while back. That man was sweating.
I also want to point out he put alcohol on my ankle. I am not ashy like this all the time. This is very vulnerable for me. I do it for y'all.
You feel exposed a little bit.
Just a tad.
It's off of fans.
Well, I will say you're 4 needles deep and you're already doing exponentially better than Warren has been in the past. Keep that energy, all right? We got... Give me 2 more.
Okay.
Tanisha was sitting at a 6 with the Shockwave instead of a 4 before.
Yeah.
That's a healthy level to be sitting at, though.
Now her tolerance is just there.
It's true. Last one. Yeah. Ended on a high note.
Yes.
At least you're laughing through it.
Yeah. Laugh to keep away the pain.
Exactly. Exactly. You laugh in order not to cry.
Exactly. Yeah. This is also not my first time injuring this ankle. Former ballerina, lots of experience with those point shoes. Slipped and fell. Same way, hurt my ankle.
We see a lot of reoccurrence when it comes to ankle injuries. Once you kind of roll it good one time, your chances of continuing to roll it pretty good is pretty high in the future. If you don't take, rehab and PT seriously, getting some strength around it and the active tissues being the muscles that support the ankle. Yeah, so this is a pretty light setup. I didn't want to turn her away too much for needles since it is her first time getting it in the foot, but it's essentially how we would needle an injury to the ATFL and the CFL. If you guys have any questions about ankle injuries, rolling your ankle, anything like that, leave them down in the comments below, and I'd be happy to answer them. Otherwise, we'll see you guys in a little bit, maybe, for the laser.
Yes.
Cool.
Hey everybody, this is Dr. Warren with Dr. Angie and Roman. We are here this morning in Towson, and I'm just going to be talking for Angie because she is going to focus on dry needling Roman's first metatarsal joint, and so proximal joint. But something you might have heard of before, if you deal with a lot of foot pain, you might have looked this up on your own, turf toe. You've got an acute flare-up of turf toe, and I'm just going to be kind of giving a little demonstration with the laser and a little bit here as well in terms of what we use. So we're dry needling the capsule, pretty intense kind of for just a quick moment, and then he's able to let go for through the rest of the treatment. Roman, I love getting to work with Roman when he does come in from just helping him out, but also the fact that culturally, he's just got a lot of really unique experiences in his life, as well as what he does for a living and where he's going. So he's a big fan of Florianópolis, Brazil, which is something I kind of always wanted to go check out. So shout out to people that live in Florianópolis and that area. Roman, you got to meet somebody today that came over and helped out your house.
Yeah, I have a funny story because I had a Comcast guy show up to take a look at some wiring, and then, you know, we were chatting for 15 minutes, and right as we were saying goodbye, he looked at me and he said, "Do you go to Kalkstein Chiropractic?" And I said, I do. And I thought he was another patient here, but he had actually found you through your videos online and had seen another video where you adjust my spine and had actually remembered. I guess he said he recognized my
You're
voice.
a star,
Yeah.
huh?
I felt like a minor celebrity in the world of chiropractic.
Let's go. Good stuff. So I'll let you guys go ahead and watch Dr. Angie dry needling. She's doing a wonderful job over there.
She is.
Angie's got good touch, good hands, and she's doing a pretty intense setup, but you can tell how kind of patiently she's setting the needles, and Roman was able to talk through all that, which I don't know how he did that, but I'll let you guys kind of jump in there. And Roman, it's good seeing you. Hope you feel better, all right?
Yes, thank you so much. I really appreciate the care.
For sure.
So I'm gonna get a little bit underneath it as well,
Okay.
okay? Yeah, a little jump there. A little tender spot. Good. You're doing so great.
Thank you. I feel
Look a little
it's
bit
the
like a
most-
Frankenstein toe.
Yeah, it's a little bit the most intense dry needling I've gotten ever. So
Yeah, so with turf toe, it's the tendons around the toe. It lifts it as well as what helped to like lift the toe, as well as why it hurts to kind of roll, like point down, or if you were to try to curl your toes. So I kind of wanted to get around it, which is what we did. We kind of went from the medial side all the way around. I always try to start at the point of least tenderness, just so it's not to alarm the body a little. But we're gonna let this sit here for about 10 minutes and let your body just kind of do what it needs to. Let it relax with the needles. I'm actually gonna get one more right in here.
yep.
When we think about the tendons and how they come up the foot, we want to address like how they pull.
Oh,
So-
yeah, that's a good spot.
Yeah.
Oh,
There we go.
There we
Awesome.
go. That was
Just that
intense.
one
Thank
little
you. That
one
was
there.
good, yeah.
Okay. We'll leave you here for about 10, okay?
yeah. It hurts for a sec, but then it actually releases a lot.
Exactly. That one little like inch of pain, but then we subside.
Yeah.
Hey guys, it's Sven here in Towson, Maryland. I'm with my favorite patient, Christy, and Christy and I go way back. This is our first time really treating a pretty significant ankle sprain. So this year I thought Sven was, so circle back, Frozen, okay? There's a movie, and there's two of them I think, and I'm watching Frozen 2, and I'm like, oh okay, this is our shtick this year. This is our family's kind of get up. We're all going to be parts of Frozen. I thought Sven was like the big Swedish dude that rides the reindeer, and then my wife pulls out the reindeer costume, and I'm like, oh, I'm the reindeer, huh? Okay. And my kids are like, get down. And so I've just carried kids around all Halloween. Princess Anna, not kids, Princess Anna and Princess Elsa, which has been fun. So, Christy and I go way back. She actually did some artwork for my first Scarlet, which was really fun, and I have that up in her room. And then, as well as of Cam and my wife, a picture of Cam looking at the bump, which is one of my favorite pictures. We go way back. She's done some artwork with me. She's got a high ankle sprain and lateral ankle sprain, so we treat that here in our office. Doing some soft tissue work, doing some using acupuncture needles to do dry needling around the tissues that she aggravated during the injury itself. It's about a week old. It's already started to bruise, which is a good sign, so it's signs that she's healing. She's also getting some therapy on the tissues afterwards, after she gets the dry needling done. And then I'm doing some soft tissue work and starting to mobilize the joint a little bit. So, can you take me seriously with this thing on, Chrissy?
I always take you seriously.
As long as you feel better, that's all I care about.
You know I'm always laughing when I leave.
Yes. So we've got, we're a weekend. I think that a lot of times people get ankle sprains and we get this recommendation off the bat: boot, rest, 3 to 4 weeks, sometimes longer, and we'll find we get better results a lot sooner. We got her into tennis shoes within like 3 or 4 days after the initial injury, and just moving and walking comfortably, not aggravating it, but moving to a point where she opens it up and loosens it up. So there's definitely an art to healing of applying movement and treatment in the right way and manner early on. So we take this 3 to 4 week turnaround and we put it down to a week, and we really speed things up. And then ideally on the back end, just doing the right things from a load standpoint so that she's got good recovery down the road. All right, ankle sprains 101, right there, baby. Boom. So we've got everybody in costume today.
Everyone looks good.
Who do you like the most?
I haven't seen everybody.
You haven't seen everybody? Okay.
No.
Oh, I see what you're doing. And then who so far?
I'd have to see you carrying around the princesses.
Oh, yes, that's definitely a part of my outfit.
Yeah,
for sure.
you're only half complete.
Who so far have you seen that you've thought, oh, that's a good one?
Beetlejuice.
Brady's Beetlejuice
Yeah.
is phenomenal.
He's so tall.
He's such a big dude, I know. He's got his newborn in here right now, and I'm like, this kid's gonna be a giant just like Brady. Lymphatic sweep, some soft tissue work on the top, and then I'll get into individual tissues. Just try to get her to relax a little bit. It's hard, it hurts. I know, sorry. There you go.
I'm trying.
I know you are. I appreciate you. Yeah, sorry for the discomfort I'm causing you. It's all in good aim.
No pain, no gain.
No pain, no gain, baby. Pain's just weakness leaving the body.
That's right.
That's one of them, for sure. Can be the truth. Yeah. Good. Bring your toes back for me. Nice. And toes down towards me. Good. So the first week, this is the majority of the work that I'm doing. It's like kind of just nice, patient lymphatic sweep in, and then I'll get in and I'll individually strip different tissues, the fascia in that area. Christy, how do you feel after I work on it like this? Not during, obviously.
I know that it's definitely healing faster than it would normally.
Go.
I feel like I have a lot more range of motion when I leave.
Good. So same, better, worse when I work on you. Afterwards, my goal is always obviously better. Some sessions will be a little bit more intense and she might be a little rocked for a day or two, and that's okay too. So it's not always like, oh, that wasn't that bad, I feel great, you know. And sometimes it's like, okay, we really dry needled, I'm sore,
Yeah.
right? And we're stimulating that response, but we change the treatment. It's not cookie cutter each time. And then rest. It's hard to sit with this one. It pulls my head back. Like this. It's good. So I'm excited to say that our team is growing again, and we've got a new chiropractor joining us in January full time. So we'll have 5 chiropractors, and then we have a preceptor joining.
That's awesome.
Yeah, and we've integrated our practice, so we've got primary care, regenerative medicine now part of what we do.
Yeah.
And it's really tailored based off of the needs of Dr. Jeff.
Well, that's nice.
Everything that he's needed, we've created in the environment of the office.
I like that.
And then it's just also served our patients. It's worked out really nicely.
That's awesome.
It's fun. It's been really, really fun to add in the clinical steps, stay conservative, really drive people towards the gym, and and kind of meet them where they're at too, like what they're looking to accomplish. If it's just a place to rest and recovery, and injury management in that capacity, stress relief, And then that's what you see me for, right?
Yeah.
Stress relief right
Stress
here.
relief.
This
Yep.
is very stress relieving for you.
Very much so.
No, I got you. Pull your toes. Good. Curl in towards me. Good. And toes back. Yeah, partnered actually with my wife's group, Insight Therapy. So she's got a mental health practice. And so we use them for the real mental health treatment, not what I'm talking about. Like, but there is something to be said about body work that's very relaxing.
Very much so.
Yeah, right on. Are you ready to get to work for real?
No.
We're still in the light phase. It's all good. So we're located in Towson, Baltimore, Maryland. I went to school. Father's a chiropractor. That's Dr. Jeff. That's who I was just saying. And I joined his practice about 8 years ago. Got maybe one future chiropractor below me, I think. One of them might be a chiropractor.
Yeah.
Yep. My oldest is kind of getting into it a little bit. We'll see.
Nice.
It's funny. Either way, I've got a kid standing on my back at the end of most nights, telling me they want to massage my back.
Take a deep breath.
Yeah. And relax right there. I got you. And then like sumo squat, butt bounce right on the back.
There you go.
You're good. Good. Bring your toes back. Nice.
I think I'm gonna have more movement in my ankle than I did before I sprained it.
Let go, baby. Let go. I'm trying to get that win. Let's go. There you go. Bring your toes back for me. For maybe, yeah, I don't know. This video. What's this video for? Why am I doing this? Right? It's interesting the people I run into in this world. Whether it's this random kid down in Costa Rica that liked our videos and has been a fan, right? That's so cool. I love that.
Yeah.
And then I met a lot of students in chiropractic school along the way that have used them for education purposes and like to get an idea or a concept of what practice looks like or injury management looks like, because you do get it in school, but it's nice to see real world stuff.
Yeah.
So some of the dorsal ligaments I'm working on the back, I'm taking my fingers and I'm pulling through and I'm creating dorsiflexion and eversion in her foot, and that creates a stretch on those tissues, so I'm going to hook those fingers in there. And then I'm bringing her toes back gently. And this is where the ankle gets sheared in most eversion sprains. But she really, inversion sprains, but she was really toe heavy when she fell and she strained it. So that's why you see this pattern of bruising through the top of the foot. Come back for me. Good, back down. And then I'll work on calcaneofibular ligament through here. This is another really hypersensitive area. Now you're going to point down and in. Usually the mechanism of injury really puts a little stretch on that. Hold, compression, reduces swelling, helps with pain management in the tissue. From a fiber orientation, as scar tissue starts to get laid, it helps it orient it in the right direction so it doesn't get bound up, stiff later on. It improves the function of the ankle. And then I'm going to go through the extensor retinaculum. I'm going to work below and above that. Straight down at me. And so as you can see, every time I've kind of intentionally put pressure on some of these injured sites, it's a little uncomfortable in those areas. So I'm not going crazy on them right off the bat, but I'm definitely warming up. I've added pressure as I've gone on in this session. And it's just allowed me to kind of get a little bit more depth. I'm going to work on some of these tendons, these peronei, tertius, and some of these muscles that help extend the foot itself. Just gently sweep through some of these areas. Sorry, Christine. There's a lot of swelling here, not a lot of space, super sensitive to pressure, but she's doing a lot better with it. And then I'll go through and I'll hit posterior tib. Hit as in I'll do a pin and stretch through the backside. And that'll help take some pressure off this ankle and calf. Good, you can see some of the swelling and the pulling through here from the ligamentous and the strain, the shearing that happened right here. Blood usually pools like a week or two later. Hers came pretty quickly, which is a good sign. All right. And then I'll go to some of these points above. Palpate for trigger points, do ischemic compression for 60 to 90 seconds. That's all the hand work that I'm going to be doing with her, okay? And then I'm really encouraged to try to walk slowly and with control, exaggerate the gait. The more you shorten up the step, I feel like it really doesn't aid in recovery in these kind of cases, not all the cases. That's what I recommended in her case, and it does loosen her up after a while. I'm not going to sneak any adjustments in, I swear. Good. So that's a session of soft tissue work on a sprained ankle. That's, I say, a week and a half.
Week and a half. Mm-hmm.
Okay. And then we've got some at-home stretches, exercise that we're doing, some PT in here as well. We'll follow up after 2 to 3 weeks. I'm going to do a lot more with her next week. She'll let me, most likely. And from the regenerative side of things, how we would manage this, there comes the sun. Peptide therapy, PRP, and the ligamentous strain that she has as an option. She has an MRI scheduled for Monday that we sent her out for. So we'll find out what's happening from a detailed standpoint. I can diagnostic ultrasound and evaluate like today if I wanted to, but she's responding well to care, and we're not in those phases of making a decision there. We're just trying to become a little bit more ambulatory, get her back to work as soon as possible, safely.
Very much so.
Cool. Alright.
Hey, it's Nicole over here at Kalkstein Chiropractic. I'm here with Eddie. He's going to be doing some Shockwave on my calf and my heel for some plantar fascia. So we're going to go ahead and bust that out because I have been neglecting myself for too long. Are you ready, Eddie?
I'm ready. I'm ready.
I don't know if I am, but we are now.
Go ahead and raise your ankles up for me. And then lay them right back down.
Thank
Perfect. Let me see here. So you're having a lot of issues like on the lateral side?
Lateral side,
Lateral
and then
side.
the whole calf is just kind of done.
Okay, gotcha. Feeling a little stiffness here.
Yes. The calf is going to be really tight for sure. The foot, I'm unsure, but I'm sure it's also going to be not wonderful.
Awesome, thank you. Yeah, no problem. Love to see you. All right.
On the foot, you might find something more towards the toes too.
Okay.
I just don't know.
Gotcha, gotcha. We'll work everything out over here.
Yeah, what's that? Oh yeah, he was super funny. He was on the piano the whole time, just cracking jokes and playing songs.
Nicole, are you ready?
I'm as ready as I'm gonna be, Edison.
All right, let's get it started.
Okay, that's not terrible.
Not too terrible?
Nah, you could probably go up a little bit. Yeah, you can crank it a little more if you want.
Gotcha.
Yeah, that'll be it.
That's good. Gotcha.
Yeah, right down in there. Yeah, it's like all down by the ankle too. Is like where it's all so tight. Yep.
Right in here. Gotcha.
Not fun.
Nicole, you doing okay with this intensity?
Yeah, I'm okay. You might be able to crank it up a little bit.
Okay.
Just because I feel like I'm getting used to it a little bit. Yeah. Oh my goodness. You're right. It's all on that lateral side for real. Ugh. Ugh. Yep, in there. Yeah, go right in there, that middle.
Right in the middle. Yep. Now you feel it.
I like didn't even feel it until you hit that one part of my side, and I felt it go all the way through.
Yep.
Because those sound waves, when they travel, it's like you can almost feel where it wants to go too. Oh my goodness. Kind of wild. Whew. Yeah, we definitely need, I'm glad we didn't do focus. Because that would have been, oh my God. So fun fact, I have lesions, bony lesions on my ankles, so I feel like when I do the shockwave too, I feel it like a lot of increased range of motion in my ankle too. And I really would love to know if it is like helping with that lesion or not. I have to ask the docs and see what they would say. Oh my goodness. Whoa, what's going on in my calf? Yep. Ah!
A little too much?
No, it was just that lesion. I felt it.
Gotcha.
Yep. Like when you're in there, I feel.
Yep.
Oh my God. Ooh.
Nicole, you're doing great. Keep up the great work here.
Oh yeah, totally. Wonderful. Oh. That was crazy. Oh my goodness. My ankles are messed up too, so that's why.
We're almost done here.
I can breathe.
We're halfway there, Nicole.
Woohoo!
Alright, so let's
Yeah, I'm curious about my foot, I'm not gonna lie.
Yeah.
Because it's been a minute since I did my foot.
I don't know if they do like a lunch menu or not. That's like cheaper, but traditionally with Korean barbecue, it's when there's like.
My calf already feels looser, and I haven't even moved it.
Stay there the entirety of the time because that's like what you're paying for.
Go on to the ankle.
You want that.
Gonna lower down the intensity just a bit.
What do we want next, boys? Because like the whole time, you know, they're bringing out kimchi, they're bringing out like all the.
There we go. Let's get started.
Let's go.
It's a communal thing. It's not like, all right, let's knock it out 45 and we gotta get back to the office. So it's like, we're gonna sit down. Savor it.
This is gonna be terrible. I already sense it.
You ready, Nicole?
I'm as ready as I'm gonna be.
Hold on, cut that video real quick. Having a little bit of trouble with difficulties.
Are you switching the head for me?
No, what is it? Something inside. It's got a little.
Is it that noise?
Yeah.
Oh my God.
Oh shoot.
It's always that noise. I'm just trying to get some treatment. Carly's getting good CA content. Day in the life of a CA, the shockwave's making a funny noise.
Right, here we go.
Oh my god. I knew it. This was gonna suck.
Right here.
Yep.
Gotcha.
Oh my. Oh yes. Fun stuff. I'm curious to see if you go on the bottom of my foot, like graze towards the bunion and see what that does.
Gotcha.
Oh my. Yep, right in there. I feel that in my bunion, but then also in all of my other toes. Oh my goodness, and it feels so good. It's like right in there, Edison, is where it goes numb. Every shift by 5 o'clock, right there is numb on my foot. I have no idea why. So, yep. Eddie knows. He's my bunion man.
Oh gosh. Oh, man.
He's like, please no. Sorry, Eddie. You done did it to yourself. Oh, yep. Oh my goodness. That's insane. Is my toe moving? Feels like it's moving. That was fun. Whoa. That's such an interesting feeling.
Feeling okay?
Oh yeah. I like it. Wow. Like it feels like it's totally working, but like in a way that I don't think I felt with the focus, because we've only ever done focus on my bunion. The radial, I don't know why. It's like similar but different. I feel like this is massaging it a little more, which just feels a little bit better. When I also feel what the focus was doing, that like stingy feeling.
Right.
Interesting. Wow. Thanks, Eddie.
Of course, of course.
Oh,
Here, let me clean you up here.
thank you so much. All right, people. That's about all I can handle over here at Kalkstein Chiropractic. We will see you next time.
How's it going, everybody? It's Dr. Nick here at Kalkstein Chiropractic. We're here today to talk about plantar fasciitis. So, a little bit about it. A little bit of a misnomer, you know. Itis at the end of a word typically indicates there's inflammation. But with plantar fasciitis, there's actually an absence of those inflammatory cells. It's more of a deterioration condition. Chronic, ongoing. It affects roughly about 75% of the population. Just kidding. I can't remember the stat. It said maybe 50 of us.
They weren't bent backwards or anything, so.
Affects women at a higher rate than men. Typically later in life, 45 to 65. That doesn't mean you can't get it. We see it a lot in runners and people that stand on their feet all day. So, how do we treat it? The most effective way we treat it here in the office is with this focus Shockwave. We couple that with a couple other things. So, of course, we like to do joint manipulation, some soft tissue work. The calf, the gastroc, the soleus muscles are very tight. We'll do dry needling through those regions. But for the plantar fascia itself, especially at the base of the heel here where it connects into the calcaneus, is our bread and butter is focus Shockwave. So, I'll show you what it looks like and we'll go from there. All right, so let me know. You ready?
Yeah.
You want to get over this shoulder if you want to look a little bit more into it. How you feeling with this?
I'm feeling it.
Okay. So obviously plantar fasciitis being a very chronic condition, it's very stubborn. You know, we're on our feet all day. Most of us, we're pretty active. Some classic signs and symptoms of this are the first couple steps in the morning time after we've rested are very painful. It warms up. Once we get moving, we start to do our daily stuff, but there towards the end of the day, after we've put a lot of stress to that tissue, it can start to be pretty uncomfortable for us as well. In really severe cases, even sitting for a prolonged time and then going to stand up and walk can be provocative as well. So treatment, use this, I guess, word lightly. It's pretty intense. You know, we want to get some repetitions into this tissue. We want to facilitate some change, especially with focused shockwave. We want to help stimulate that stress response. That way the body knows where it needs to heal at. So focused shockwave, radial shockwave as well, is creating a little bit of micro trauma, and that alone causes a little bit of inflammation. But that also tells the body like, hey, this is where we're injured. Recruit some growth factor, bring in some blood to this area. Let's help heal this tissue. So roughly 6 weeks is the minimum recommendation in terms of treatment. And on average, it usually lasts a couple months. Most cases, about 75% of the time, resolve within a year. So 12 months. So it's definitely one of the more stubborn ailments we treat within the office, but we get some good results with focused shockwave. Of course, we couple it with some rehab. So we want to work on biomechanics to the foot and ankle, build up some strength and structure around this region, take as much stress away. That was the first 1,000. You okay with that?
Yeah.
Okay. We're gonna go for another 1,000.
Okay.
As far as other sort of treatments, there's some new research coming up talking about PRP, stem cell, stuff like that. Pretty new, not a whole lot of evidence, but they are seeing good results with it. And of course, surgery being the very last of the options. You know, you want to try to avoid getting tissue cut and damaged in that sense. And even with surgery, it's not a guarantee that it'll resolve the plantar fasciitis. So even though it takes a while to treat, conservative remains the best course of action. There's no shortcuts to good stuff. So you want long-term lasting results, you're gonna have to put in the work, put in the effort. And that's a good spot. All right, just a little bit more. 3, 2, 1. Good. All right, so guys, if you have any questions about plantar fascia, how we can help you here, schedule an appointment, get a consultation, you know, get a discovery session. We'll discuss whether it's right for you or not. Otherwise, we'll see you in the next one.
With the MRI that I picked up on you, and that you brought in, I should say, you have a history of spraining this ankle. Where does that come from? Is it sports, running?
15 years ago, had an accident sled riding.
Sled riding?
Yeah.
That was where you had some significant trauma to the foot itself? A couple ligament tears that are, like, we'll call them historic. They've been there, if you will, right? So do you ever get pain in any of these areas here with your foot, or is it mostly on the back side?
It's the side there and the back.
Side here? Yeah. So you have a little stress response in the bone and the ligament over in this area on the MRI itself. I don't know if you read that, but so it'll be helpful to get a little bit of work done through here too. Have you ever worn a boot?
Do you mean like a cowboy boot, or do you mean like literally a
Well, you know
boot?
what? Now that you bring it up,
Because yes,
you've been to Stampede in
that's
Calgary
actually my
before.
primary.
His boots?
Yeah.
Okay.
But no, I've had the thing where you sleep in it and then the walking boot thing.
Gotcha. The motor cares. We're gonna start with Shockwave here. I feel like I'm not getting quick response within the next 3-4 weeks. I might do a referral in-house to Caroline. Caroline's our integrative medicine medical provider. She does PRP injections. PRP can be really beneficial for this type of problem without having to use a steroid. And it's basically taking your own blood platelets, you spin them, you take the good stuff out, and where you have small tears like this, it can be healing for that tissue. It can help regenerate that tear, okay? And so can Shockwave, so we're gonna lean into that for a little bit, but you might be a really good candidate for PRP, and we can evaluate that in a month from now, okay? I don't think you need a boot. But you will use one after if you get PRP. That's the only time. Okay. Point your toes down towards me. Cowboy boots, huh?
For years.
For years. You from Baltimore?
I am actually.
Okay. That's like, that will be a first for me. Someone from Baltimore wearing cowboy boots.
All the time.
Point down towards me. I went to San Antonio, Texas. That's about as cowboy as I've gone in the last couple of years. And bring your toes back up. But I want to go to Calgary and go to Stampede again next year.
Oh yeah.
Have you ever been up that way?
No.
That's a really cool area. Good. Point down for me. Good. A little pressure through tib anterior over the mortise joint. I'm working on the, it's called the ATFL ligament, anterior talofibular ligament. Right in this area here, that's where he's got a little stress response. Right. So just ischemic compression, pin and stretch, working through this tissue. This is an ART protocol for it. This will help it feel better and move better. Okay, go ahead and pull your toes back. I want to work adjacent to the Achilles tendon here. Go ahead and push your foot into me. How's PT?
It's good.
Good. All right, and then back up. Point at me. So we got, this is our second visit. We have had Shockwave, radial shockwave, focus shockwave, ART. We're gonna do some adjustments here. Done about 15 minutes of PT. And then you're gonna add a YouTube video to boot. It's all in a day's work, baby.
Yeah.
Let's go. Point down at me. And then come back up. And I should probably stop doing these foot videos because I have like 6 ankle Achilles tendon patients right now. I'm gonna be marketing myself as the foot doctor in Baltimore pretty soon. I'm okay with it. I want to help people. Bring your toes back. Good. And point down. And relax. So, you're not gonna give me any info where the cowboy boots come from?
Just families from Virginia. We've always sort of done it. So
Virginia is like northeast, but it tries to pretend like it's southern.
No.
South of the Mason-Dixon line.
That's
Yeah, I know.
exactly
It's farm country out there. I get it. Man, it's pretty. You go out to near Charlottesville in that area. I love it out there. My sister went to school at UVA, and I was like a senior and then freshman in college, and I would go and visit, and she'd take me out. It was like the best time. I had a Jeep Wrangler. I was driving out there like every other weekend, coming out to visit her and her friends. It was awesome. Good people. You're gonna feel a little release here, okay? Just like that, okay? But a little quicker for me. Good. in the knee. It's good. Virginia, huh? There it is. Alright. Let's go 2 for 2, man. Let's make this happen. Table up, do the stretches in between the sessions. Yep. I'll see you next week a couple times, okay?
Yep.
Hey, thanks for watching.